Today, we're diving into Lisinopril. It is, without a doubt, a giant in the world of cardiovascular medicine. I mean, it's one of the most prescribed drugs on the entire planet. But for the millions and millions of people who take it, there's usually one big question lingering. Right? How does this little pill, taken just once a day, actually do its magic inside your body? Well, that's what we're here for. Let's unpack the science behind it. So, before we can really appreciate the solution, we've got to understand the problem. And for so many of us, that problem all comes down to pressure. I want you to think of your heart like a pump that's always working against some kind of resistance. Now, when you have conditions like high blood pressure or heart failure, it's like you're forcing that pump to work way, way harder than it's supposed to, 24/7. And over time, as you can imagine, that constant strain can lead to some really serious damage. Okay, so how does our body even regulate all this pressure in the first place? Well, it turns out it has its own built-in system. It's this fascinating, kind of complex chain reaction of hormones called the RAAS system. That stands for Renin-Angiotensin-Aldosterone System. The whole thing starts like a series of dominoes falling. See, when your kidneys sense that your blood pressure is a bit low, they kick things off by releasing an enzyme called renin. Renin then goes and creates a substance called Angiotensin I. The next domino is a really key enzyme, just called ACE, that converts Angiotensin I into the much, much more powerful Angiotensin II. And that is the final step, the big one that really drives your blood pressure up. You know, Angiotensin II is the real powerhouse here. It's basically the body's master switch for cranking up the pressure. It does two major things. First, it physically squeezes your blood vessels, making them tighter. That's called vasoconstriction. And second, it sends a signal to your body to hang on to salt and water, which increases the total amount of blood in your system. Both of those actions together, they send your blood pressure soaring. Now, in a perfectly healthy body, this system is a lifesaver, right? But when it gets overactive, it leads to chronic high blood pressure. So, how do you stop this runaway train? Well, this is exactly where Lisinopril enters the picture. Lisinopril is part of a class of drugs called ACE inhibitors. And honestly, the name tells you pretty much everything you need to know. It finds that angiotensin-converting enzyme, the ACE from that domino chain we just talked about, and it blocks it. It just stops it from doing its job. And the result is a total 180. It's actually pretty elegant how this one simple, targeted action can have such a huge effect on the whole system. By blocking ACE, Lisinopril stops angiotensin II from ever being created. So what happens? Your blood vessels relax and open up. Your body lets go of that extra salt and water. And the direct result of all that, your blood pressure goes down, which gives your heart a much, much needed break. All right, so now that we get how it works, let's take a look at why it's one of the most prescribed medications in the entire world. Lisinopril is a real workhorse for several major conditions. For just plain old high blood pressure, it's often one of the very first things a doctor will try. In heart failure, because it makes it easier for the heart to pump, it can dramatically improve symptoms and quality of life. After a heart attack, it's even been shown to improve survival rates. And for patients with diabetes, it offers this special protective effect on the kidneys, which is incredibly important. What this all means is that Lisinopril isn't just about lowering a number you see on a blood pressure machine. By easing the heart's workload day in and day out, it's actually providing a kind of protective shield for your entire cardiovascular system. This helps prevent things like future strokes and further damage to the heart itself. But of course, like any effective medication, it's not without potential risks. So it's really important that we're aware of the side effects, everything from the really common ones to the very rare. Okay, so the most famous side effect is definitely the ACE inhibitor cough. This can affect up to 1 out of every 5 people who take it. It's this dry, nagging kind of cough that just won't go away. Now, it's not dangerous, but it can be really, really annoying. And it's probably the #1 reason why someone might get switched to a different medication. And then you've got the serious stuff. Now, let me be clear, these are much, much rarer, but they absolutely require immediate medical attention. We're talking about things like angioedema, which is rapid swelling, dangerously high potassium levels, a drop in kidney function, or a sudden severe drop in your blood pressure. Let's just focus on angioedema for a second, because this one is absolutely critical to understand. It's a rapid, deep swelling, especially around the face and throat. And if your throat swells up, it can block your airway, which is a full-blown, life-threatening emergency. Again, it's rare, but it is the absolute #1 reason to get yourself to an emergency room immediately if you even suspect it's happening. So, to pull all this together, let's go through a really clear safety checklist based on the most important warnings and potential interactions. This, right here, is the single most critical warning. And there's a reason we're showing it as a direct quote from the medical literature. Lisinopril must not be used during pregnancy. It carries a severe risk of causing injury or even death to a developing fetus, particularly in the second and third trimesters. You also have to know that lisinopril doesn't always play well with some other very common drugs. For example, taking it with NSAIDs, think ibuprofen, can make it less effective and also raise the risk of kidney damage. And since lisinopril can already increase your potassium, combining it with potassium supplements or even certain types of water pills can push those potassium levels into a real danger zone. So here is your takeaway checklist. Before you ever start taking this, it is absolutely vital that you tell your doctor everything. I mean, everything. Any history of that swelling we talked about, angioedema, every single other pill or supplement you take if you are pregnant or even thinking about becoming pregnant, and any history you have of kidney problems. Being totally open is the key to using this drug safely. At the end of the day, a medication like lisinopril is an incredibly powerful tool, but using it safely is a partnership between you and your doctor. Understanding how it works and what you need to watch out for, that's what empowers you to be an active player on that team. So the question I want to leave you with is this: are you having the right conversations about your health?